Bonsoir tout le monde. Thank you very much for putting the table. I will present a little PowerPoint just because I'm less fluent in English, and I'm really sad when I hear the way the people were speaking before, because it's so convincing. So, forward. Okay, thank you. So, very fast, what are we speaking about? Not only STS, as we've spoke here during 2 days, but more relationship between citizens and science, and more specifically, we will say that about technosciences, which is more specific, and I will explain why. Why this emerging agenda? Essentially because there's less confidence in the way the government is dealing with all these issues. An incredible diversity of factors. The people who are interested in STS are not only the people who are in the community of STS. I was teaching in STS at the University of Quebec 20 years ago, and I continue to do it with a lot of different groups, but not inside this community. Some key question and approach, I will just say a word about some issue in health and environment, because I think they are key questions. And some challenge. So, because I don't think I will be able to do it in 5 minutes. So I go it fast. I think we have to change science, which include social science, human science, engineer science, and all that, and fundamental science, to technosciences, its market and the relationship to the states, because I think the major issues for citizens, it's around these issues, and I think Pat Mooney has framed it very clearly. In reality, the citizens' agenda are generally more global-oriented towards concrete questions, especially in the fields of environment, health, and major technological shift. I'm sorry. The diversity of the actors, it's just unbelievable how many people are interested in this field right now. And it's sad, I didn't have time to make a map of all these interests, but there's many, many thousands of people. So there's some individuals as public servant, as alerteur, I don't know the word in English, as member of citizens group, professional networks. You know, if there's so many people who are organizing themselves, for example, in Canada, you have CAPE, the Canadian Association of Physicians for Environment. There are more than 5,000. There's a reason why they are organizing around these issues. And it's the same thing for Council for Responsible Genetics in the United States, Physicians for Social Responsibility, and in fact, there's 100 associations like that in the world. There's also citizens which are becoming sometimes expert citizens in some case, but in large majority they are involved in collaborative national and international networks, for example, Science in Society in social forums, but there's many, many of them. There's also research project. In Europe, there's a lot of research projects which are done by, 2 minutes? Okay, and there's also the Parliament, and I think the Parliament is very, very important. There's real debate at the Parliament in Europe, in France, and even at the Senate in France. You know, even here, when you remember the time where Whelan, for example, were presenting a report on agriculture at the Senate, we had these possibilities to have relationship between citizens and why they are involving in these issues, essentially when they are really concerned directly. This is from Nature last week. It's a new study who showed that for climate change, it will come at least 10 years before, but exactly we're speaking about the pole usually, but it will come, comment on dit, au milieu, là. It will come at the equator, mainly. People who are concerned with extreme events, you have there the evolution of extreme events. So they have reason to be more interested in that. The way they are thinking about all these questions, it's in relation with ecosystem impairment and health effect. In Canada, we have done a lot of work on health issues and to reframe health issues. But we have some example in EcoHealth, for example. But IDRC is exporting these ideas outside of Canada. But we don't use that here right now. We are stuck with old models. Public expenses for long-term health will double in 2050 in OECD countries. So it has to be reduced through prevention. And the great majority of sickness can be prevented, in fact. Here it's a little map related to a book who was just published last week by André Sicolela in France. You have the increase of cancer and diabetes and CVA. It's just unbelievable because, even in North America, we have one guy on 2 and one woman on 3 who will have a cancer during his life. It's a public health crisis right now that we are facing. We have other data which were published by CDCs on autism, an incredible increase, 1 children in 88. It's recent data. All that to say to you that we always focus on more of the same, I will say, in health question. And we are thinking that by doing some specific work of research related to genetic, for example, it will be better. But we know perfectly well right now that the social determinants of health are related mainly on social, les écarts sociaux, on social gaps and economic gaps mainly, and environmental issues, and not on healthcare as they are developed right now. So we have to reverse the perspective. But we are not in the right way. For example, on nanotechnology, we know perfectly well that to develop nanomaterials and nanointermediates, we have to have nano-enabled products. But nowhere in the world, only in France, and since a couple of months only, we have obligatory declaration of nanos. Nobody knows what's there. It's impossible to know what kind of object are on the market. We've done a little research with my students showing that just in one sector where it was supposed to be to have about 100 products on nano argent in nano silver. In fact, we found more than 500 products, but some of them are baby bottles, and they are produced for more than 80% in China and South Korea. So, and it's just one example, but I think we are not looking always to the good direction. We don't have enough wider perspective. We're not making the links, and we're continuing to have programs at universities who are insisting on the ultra-specialization when in fact we need the specialization of the links between the phenomena. Thank you.